I am in front of you to explain the possible treatment available by perusing the internet. We have formulated a treatment for that. Now Ebola is threatening the whole world. It is now is an endemic, an epidemic in Western African countries. This is caused by Ebola virus, which is very, very small. It is by electron microscope you can see it. The length is only 970 nanometer. It has got a colleague. Ebola virus has a Marburg virus. Along with that is called filovirus family. It is transmitted from fruit-eating bats originally. And after getting into the human cycle, human domain, it is transmitted from the body fluid, saliva, urine, motion, and secretion from the skin area. It is so contaminated, so very severely contaminating, easily contaminated, and causing death to the extent of 55 to 90%. So it must be contained early so that it will not go spread on to resulting in pandemic. Now it is endemic, should not allow it to go pandemic. We have devised a new treatment protocol which I will explain later. Pleasant greetings to you all. I am in front of you trying to explain that there is a treatment for Ebola virus while the whole world is lamenting that there is no specific treatment or vaccine. With the hope in this new millennium, there must be a clue or a report about antiviral action of anti-Ebola action available in the net. Internet, we searched and found that there are two important publications taken place last year. One is Dr. Peter Madrid from America. He has worked in the Army Hospital and other hospitals and universities and shown that chloroquine has got an antiviral action against Ebola virus. And another worker, again from America, Johansson, again from USA, his colleagues also working in the Army Medical Research Institute. So they have shown that estrogen receptor modulator inhibit Ebola virus. And both the reports with the heading itself, FDA approved selective drugs. So it is easy for us to adopt it for treatment of Ebola virus because already FDA approved. Another important point is these drugs are already in existence for other indication of the diseases. So it is repositioned and repurposed so that it is easy to include in the treatment schedule of Ebola virus. We need not go to phase 1, phase 2 study. Right, now we will take it one by one. We have formulated this new project by giving 4-prong attack on this Ebola virus. Number one is antiviral. Antiviral, we have got four entities, 4 drugs. One is chloroquine. Chloroquine is an anti-malarial drug, anti-inflammatory drug, anti-amoebic drug, now metamorphosed into antiviral action against Ebola virus. It is proved by both test tube studies as well as animal studies showing that it has got a blocking action of the attachment and entry of the virus into the tissue cell, and after entering the tissue, it will block the multiplication of this virus. And they have worked out the dosage schedule, duration of treatment also. So it is easy for us to use it straight away in the Ebola treatment. The next set of drugs are clomiphene and tromiphene. Both are estrogen modifier. They have shown that again, just like chloroquine, it blocks the entry of the virus into the tissue as well as after entry, multiplication is blocked. So both the drugs all 3 drugs are having similar action and FDA approved and repositioned or revalidated in the new position from the original inherent action of these drugs. Fourth drug I would like to add into this armamentarium is ribavirin. Ribavirin, all of you know that it is a broad spectrum antiviral agent. It is invented for respiratory syncytial virus, but it is useful in many viruses, both the RNA and DNA virus. So we can incorporate that into this regimen and have a beneficial additive action. So 4 antiviral agents we have formulated in this venture. Second group of drugs is nitazoxanide. Nitazoxanide is an anti-emetic, intestinal anti-emetic. It has been found recently that it is having antiviral action by inducing the innate immunity of the body. It has been shown in hepatitis B and C viral infection. So we can definitely use it in Ebola virus. Similar action is warranted here also. So it is very useful, 500 mg PD. The third attack is anti-cytokine. You all know that cytokine is a chemical which is poured into the area of inflammation in a case of infection and injury in a person. It reduces the inflammatory area and brings back the normalcy in the body. But in some conditions where there is escalation of severe infection, resistant form of infection and major injury, accident causes the cytokine pouring in will be more than required. You can call it as exorbitant level, and it can even reach stormy level. Cytokine storm is being described. In that condition, the whole of the microcirculation of the body, all tissues lose the functional capacity of the capillaries in the microcirculation. Capillaries start leaking the blood and fluid and causes damage to the whole organ, resulting in multi-system failure and death. To prevent this, I thought we can give anti-cytokine from the beginning. When you start treating on the day 1 itself, we can give the anti-cytokine along with the antiviral agents. If we give that, we can arrest the escalation of cytokine excess or cytokine storm. Number 1 drug is again the chloroquine. Chloroquine has got an antiviral action we have shown now. Now it has got another metamorphosis action is anti-cytokine. It blocks the interleukin 1B, interleukin 6 and TNF alpha, reducing the cytokine action. Next is doxycycline. Doxycycline is an antibiotic which is used in the upper respiratory tract, lower respiratory tract and other minor infections. They found that this again metamorphosed into anti-cytokine action against cytokine, interleukin 1B, interleukin 6 and treatment-aggressing factor alpha. Third drug is xylitol. Xylitol is an anti-asthmatic drug found to be very useful as an anti-cytokine. Fourth drug is montelukast. Again anti-asthmatic drug found useful as a. So these 4 drugs are anti-cytokine. Fourth angle of attack vaccine. Two vaccines have been produced now, slowly coming up for use. One is injection form, another is inhalation form. Both are having good effect, and booster is necessary to maintain the antiviral action. So with the booster it is useful. These 4 drugs are arrayed against the Ebola virus, and we can achieve radical cure of this virus infection. Another important point I want to emphasize is that it can be given as a prophylaxis for all the contacts of this disease, all the relatives and the people who have taken care of the patient. Nurses, doctors, lab assistants and paramedical people can be given prophylaxis, especially chloroquine and ribavirin. Both are very effective and useful, and we can prevent spread of the disease and radical cure with antiviral and prevention of contact. We can stamp out this endemicity, resulting in bringing the world clear of endemicity, going in for epidemic and pandemic. And those who are having any doubt, need not have any doubt, because these articles are very handy and useful. We can give credit to these discoverers and utilize it straight away because it is FDA approved drug. If you have still doubt and fear to implement, we can call the ethical committee of your institution and discuss it threadbare and come to consensus conclusion and take it up for treatment. It must be taken up as a war footing so that we can arrest this spread and relieve patients from death and infirmity. Thanking you.